the body's immune system is now reacting to these foreign substances in the body, and they're saying, hey, this isn't normal, and they cause a huge reaction. And this reaction in the body sets up this inflammatory state. So then what do we see? That's when we see diseases we can name. So now your pet doesn't just have gas, it doesn't just have intermittent diarrhea. Now they have things like diabetes, they're obese, they have autoimmune disease, they have mood issues. So those are things that we see go wrong when we don't fix the microbiome in our pet's body. Have you ever wondered why your dog's breath is so stinky and they have clean teeth and you're like, what the heck is going on with my dog? I don't understand. Or maybe you have a cat that just keeps vomiting and you're like, what else can I do? I've tried changing the foods. Maybe they're on a prescription brand. And you're just like, I don't know what else is going on. That's what we're talking about today. What you can do, how the beneficial bacteria can be manipulated in your pet's body through probiotics and food. I'm Dr. Katie Woodley, the natural pet doctor. This is our weekly coffee talk with the doc. Once again, I'm so excited to be here. As you pop in live, say hey, ask your questions in the comments below. But what we're going to do this morning is we're going to be talking about what you can do, how you can manipulate your pet's gut health, how to recognize a leaky gut, how foods impact your pet's gut health, which is so important. What is the microbiome? What are these bacteria? Why are the bacteria good? What probiotics are good? How do we assess that? There's so many different questions out there. How confusing, right? Who else has been confused by looking at, oh my gosh, I tried this probiotic, but my pet got worse. So we're going to talk about that and how to assess which ones should you be using, which ones are good. We're going to go through a couple brands at the end. So definitely post ones that your probiotics that your pet may be on, your dogs, your cats, and we can take a look at them and see, should you be continuing this? Or maybe you're throwing money down the drain, or maybe it's contributing to your pet's unhealthy gut microbiome. So first, what is a microbiome? So a microbiome extends from the mouth all the way to the gut or the back end. So the rectum, where the things come out of the body. And what it is, it's trillions of different organisms. So we have bacteria, we actually have viruses, there's good yeast, there could be bad yeast too, but those all make up the microbiome. So it's this community of organisms that are hopefully working together to help optimize your pet's health. Now, when things are off in the microbiome, that's when we see disease. That's when we see all these recurring issues, health issues, and problems that keep coming back even when you treat them because we haven't fixed your pet's microbiome. So there's different types of bacteria. So there's what we call 6 phyla, and those are going to be your Firmicutes, your Proteobacteria, your Bacteroides, Actinobacteria, Spirochetes, and Fucibacteria. So those are your 6 phyla that are going to predominantly make up like 99% of your dog and your cat's microbiome, the bacteria that are in the microbiome. And within each of those phyla, there's going to be different bacteria present. And I love these questions already coming in because we are going to talk about that. So my sweet essentials, do doggy vaccines mess with their microbiome? Yes, they do. They are one of the things that can affect the microbiome. So Plant Essentials Probiotic is what we have had good luck with. Okay, so that's another, there's a lot of different probiotics. So as you're jumping on live, we're talking about probiotics in dogs and cats and how we can use them to manipulate gut health and how they should be used appropriately, what you need to know about them and what they could be causing other issues with. So as you're coming in, post your questions about gut health, microbiome, potentially food, how it affects microbiome, and also the probiotics you're using for your dogs and cats. And we'll go through some of those at the end. So we have to keep in mind, we have all these different types of bacteria sitting in our pet's gut. And a lot of them are predominantly in the colon. So the last part, the large intestine, but we have bacteria in the small intestine too. We can't forget about those. But every time your pet eats, we are feeding the bacteria. So we're either feeding the good bacteria or we're feeding the bad bacteria, because there's always going to be a population of potentially little pathogenic bacteria that are being suppressed by the good bacteria that are saying, hey, no, this isn't your place. We've got this. And they're controlling them. And what happens is when things get out of control, when we get dysbiosis, when we get leaky gut, then those pathogenic bacteria grow out of control, or we get different changes in percentages of the good bacteria, bad bacteria because of the food that we are feeding. And so, all right, perfect. We've got another one, Pet Science All-in-One Probiotic Fiber for Dogs and Cats. And I may not know all the ingredients on these because there are seriously thousands of different probiotics out there, but keep posting about them, because what I'll do afterwards is go through them and actually see what's in them. And we can go back and look at how we assess probiotics and should we continue this, or are we throwing money down the toilet? That's so common with supplements. So what do these bacteria do? So they're supporting the immune system. So there's a thing called GALT. So gut-associated lymphoid tissue. This is where the majority of our immune systems, ours, dogs, cats, are actually in the gut. And so the bacteria are communicating with this GALT system, and they're working closely together to increase T regulatory cells, different cytokines. There's also a gut-brain axis. So the gut is directly connected to the brain. Have you ever felt butterflies in your stomach when you get anxious? Maybe when you get really stressed out, you get diarrhea. That can happen with our pets too. And it's because the gut and the brain work so closely together. The gut's also producing serotonin. So it's producing these neurotransmitters that are affecting the mood and the way your pet feels. So when their gut health is off, your pet is off. Their mood is off. Maybe they have anxiety. Who here has an anxious pet, an anxious dog, a cat that's just wild and crazy? You may see one of mine jump on the back of the chair later. I don't know. They have a crazy cat. And so these are things where the gut microbiome is working together. Those bacteria are so important to feed and support, because not only they're producing nutrients, they're helping absorption of the nutrients, they're actually producing vitamin B. If you have a pet with inflammatory bowel disease, you know how important it is to measure vitamin B levels, because that microbiome is off. Your pet has severe leaky gut syndrome, and they're not able to produce vitamin B a lot of times. So we actually have to supplement with vitamin B12, and then that helps their pet. And it's because those gut bacteria aren't balanced. So when we balance them and we use the right supplements and we use the right food, your pet gets better control of their GI condition. That's how cool this is and how much we can manipulate that to help them. The other thing that's really important is these bacteria, they love eating fiber. And there's different types of fiber. And with fiber, what happens is our pets don't digest it, they don't absorb it, but they need it because it ends up passing through into the colon where a lot of these bacteria are, and that's their food source. And what they do with that fiber is they produce what's called short chain fatty acids. So things like acetate, propionate, butyrate, which are essential for helping to reduce and feed the gut lining, reducing leaky gut, reducing inflammation. If those bacteria aren't producing short chain fatty acids, we get a whole host of problems. And so these are supporting that mucus layer in the body that helps the pet absorb the minerals, the vitamins, the nutrients from their food. And so they can get it from soluble fibers. So that'll be like your food sources. That could be insoluble. You might see it on the food as cellulose. That can also be resistant starches. And so we need to be ensuring that our pets are getting these. And we're going to talk about some of the different foods that we can use to help feed the gut so that we are ensuring that we're feeding the good bacteria, because when we don't, we have a problem. When we're not feeding them, what happens is that bacterial population gets off balance. The pathogenic bacteria then start producing what are like toxic byproducts. And that starts irritating the gut lining. So we call this dysbiosis. So dysbiosis signs. What are signs of dysbiosis? So this is when the good bacteria populations are off with the bad. The bad are outnumbering the good. So bad guys winning over the good guys in the gut. And that's dysbiosis. What are some of the signs? Your pet is gassy. They have bad breath. They have IBS, irritable bowel syndrome. They get stressed, they get diarrhea. Who's ever had a dog like that? Maybe they're reacting to your stress. These are all signs of dysbiosis. Intermittent diarrhea. The thing that happens when we don't treat dysbiosis is that it can lead to leaky gut. So leaky gut is like the severe form of continued dysbiosis. Because what's happening now, I mentioned those pathogenic bacteria, so like Clostridium, we don't want them to grow out of control, because then what happens is they're releasing those toxic byproducts. It's causing the inflammation in the GI lining. And what's happening is it's creating inflammation in the GI lining and allowing bacteria, toxins, and food particles to pass into the bloodstream. And it sets up a chronic inflammatory state. The body's immune system is now reacting to these foreign substances in the body, and they're saying, hey, this isn't normal. And they cause a huge reaction. And this reaction in the body sets up this inflammatory state. So then what do we see? That's when we see diseases we can name. So now your pet doesn't just have gas. It doesn't just have intermittent diarrhea. Now they have things like diabetes. They're obese. They have autoimmune disease. They have mood issues. So those are things that we see go wrong when we don't fix the microbiome in our pet's body. And as I mentioned, crazy animals. So in the background, you're watching my crazy kitten. So he's fine, but he has cerebellar hypoplasia. So this is a little sidetrack right now. So you'll notice that he kind of like does this as he's sitting there. You kind of see him. So this is just a little side thing, okay? Because there's a lot more kittens that are coming out, and yes, laugh, like he's hilarious. He probably will fall off the back of the chair. So with cerebellar, there he goes, cerebellar hypoplasia. So what happens is the mother kitten is infected with a virus, and the kittens in utero, their cerebellum doesn't develop as well. And so there's different stages of, some cats can't walk, like you watch him, he marches, but his gut also, like his immune system leading back into gut health, like we have to support Moki, that's the kitten's name, a lot more than say a healthy kitten. He was exposed to a virus in utero. He had coccidia in his gut. He was on antibiotics for that. He was on antibiotics for upper respiratory infection. Like this cat's microbiome was destroyed before we even got him at 6 months, But he had all those things before 8 weeks old. 8 weeks. He had multiple rounds of antibiotics, dewormers, all his vaccines because he was a rescue. So he needs extra support. So that's where we can use probiotics. So he's a good example of how we can manipulate gut health. And he eats a variety of different proteins now. We're working on transitioning to raw diet for him, but we have to ensure he's got the digestive enzymes, his microbiome is optimized. So that's he's got a great life, my sweet essentialist. Not poor baby. This little kitten, you would never know there's anything wrong. Like, he's going to be fine. He's going to do fantastic. But those are the things. We look at their past, we look at what our pets are dealing with, and how can we support them with the right foods, probiotics, and decreasing stress. So how does this happen? Someone asked about vaccines. And yes, I just got a question. Are allergies caused by microbiome issues? 1,000% yes. And that's why they keep coming back. Because we're not fixing the gut health. We focus on, for treating only with conventional medicine, we're focusing on symptoms, decreasing the itch, decreasing the skin inflammation, using antibiotics when they have skin infections. And there is a time and a place for conventional medicine, but we're missing why these are happening. What is the root cause and how do we fix it? And how do we support that microbiome? Allergies will improve almost 100% when we fix the microbiome. And there are varying degrees of allergies. I have some cases that are really difficult, and there are some severe immune issues, and there are difficult cases, and they take a long time. But we also have to remember this took time to develop. So the thing is that we have to give them time to fix it. And that's the downside with holistic medicine. It takes longer. And we are so used to like, result, give a drug, see a response within 12, 24 hours. Holistic medicine, diet changes do not work that way. So we have to reframe the way we think about medicine because we're healing the root cause. But I guarantee you, you will be much happier as a pet parent because you're going to not go to the vet clinic every 4 weeks for that allergy shot that costs, $80, or those refills of Apoquel, or using steroids, or using all the drugs, and it's not fixing the root cause. So what causes dysbiosis? Antibiotics, number one cause, wipes out everything. So we're trying to get rid of an overgrowth of bacteria. Well, the good bacteria go to steroids. If your pet is on steroids all the time, you are wiping out the good microbiome and you are causing leaky gut. Toxins. We talk a lot about glyphosate, environmental toxins. So glyphosate is Roundup. What are you using in your yard? Hopefully nothing that is a chemical, unless it's a natural, to get rid of weeds and things like that. We can't control what happens with our neighbors. We can't control what the city decides to spray, but we have to think about what is coming into contact with our pets' little naked feet. They don't wear clothes. They don't wear shoes. Usually, some pets do, but they're coming into contact with these toxins. They're absorbing them into their body. So let's take, for example, glyphosate. Glyphosate is known to be an antimicrobial. It's an antibiotic, and it's also an herbicide. So what glyphosate has done to the environment is not good. And it's in 70% of our water on the planet. It is water soluble, not a good thing. When it rains, there are microparticles of glyphosate that are being rained on you. You are drinking glyphosate in your drinking water if you are not filtering it. Like, these are things we have to think of that are there, but we can't see. We can't see it, but they're affecting our microbiome. We all have some degree of leaky gut, some degree. Do you get allergies? Do you get runny eyes? Seasonal allergies are a sign of leaky gut. Right now, we're being exposed to a lot of ash, and there's a lot of forest fires. There's a lot of toxins in the air. This is affecting our gut health. So we need to support those detox systems, but also aging. As we get older, we lose the ability to digest our food better. Digestive enzymes go down. This is why it's so essential that we're incorporating enzymes in our pets, especially as they get older. And then diet. Diet is the biggest thing, one of the biggest things, but it's also the thing that we can control the most. That's the thing. That's what's amazing about diet. Can be the hardest, can be one of the biggest, hardest changes for ourselves and for our pets. It is uncomfortable if you are not used to cooking food for yourself to cook for your pet. I get it. But diet, we can manipulate. We can use the foods that feed the microbiome and help them. So that's key. So those are the main causes for dysbiosis. So antibiotics, drugs like steroids, your toxins in the environment, in your house, aging, and then diet. And this is a great question. We're going to talk a little bit more about diet too, but what diet do you recommend for cats? Get them off kibble. I don't care if you're feeding canned, even a bad canned food is going to be better than a dry food. Canned or raw, that's what cats need. Dry is not the way to go. High in carbs, inflammatory to the body. Cats are obligate carnivores. They need meat. So that leads me into the next thing. How can probiotics help your pet's gut health? Okay, for one, a probiotic, what's the definition of probiotic? It's a live microorganism that can colonize in the host and provide health benefits to them. And so these probiotics, some of the benefits of them and why we need to think about utilizing these, especially if your pet is showcasing leaky gut, dysbiosis symptoms. So maybe we don't have a disease yet that we can name. However, they're gassy, they get intermittent loose stool, they have that bad breath, and their teeth are clean. So this is where they can compete with those pathogenic bacteria. And then also they're going to help produce those short chain fatty acids that are supporting the gut lining, reducing inflammation, and supporting the immune system and working with that GALT system to help protect your pet against viruses. There's actually studies that show that pets with a healthy microbiome, they have higher IgA immunoglobulins in their body when they're fed the appropriate foods. They have the right microbes, right microorganisms in their gut to protect them against coming into contact with the distemper virus. So I know a lot of people out there, a lot of people that follow me hate vaccines. But if your pet's microbiome is off and you are not vaccinating and your pet comes into contact with parvo, which lasts for 7 years in the ground, your pet's going to get sick. That's just a fact. And that's what I hate about seeing a lot of these things where people don't want to vaccinate. And I understand why you don't. But if you're not supporting your gut's microbiome with the right diets, they are going to get that disease that you refuse to vaccinate for, and they weren't protected because their immune system is faulty. That's the harsh reality of it. And I hate to be that blunt, but we need to be understanding how everything works together so that our pets don't get sick. Okay? So let's talk about the different types of probiotics. There are 3 different types, so 3 different categories. The first one is the lactobacillus and the bifidobacterium. So these are going to be your dairy-based probiotics. The second one is your Saccharomyces boulardii. This is a beneficial yeast bacteria. And then also we have our soil-based probiotics. So these are your spore-forming probiotics. So they have this spore around them that protects them as they pass through the small intestine. So they survive longer, they get to the colon, and they help produce vitamins and antioxidants. So the vast majority of supplements that are out there on the market are going to be your lactobacillus and your bifidobacterium probiotics, hands down. And you're going to see combinations of different probiotics in one supplement. And that's because studies show that one strain by itself is not as beneficial as combining these different types of strains. And it's because those lactobacillus, so let's talk about those first, they don't survive as long. They usually last 24 hours, 48 hours, and then they're passed out of the body. They're easily broken down. They're easily degraded by temperature. A lot of them need to be refrigerated, and they tend to help the small intestine. And so when we think about using these, I mean, they need to be in higher concentration. So we're going to talk about dosing and what you need to be looking at the package to ensure that these probiotics are actually doing what they're supposed to be doing. And so there's actually a lot of studies too. This is the really cool part. And this is how we can manipulate different diseases with different strains of bacteria. So a 2019 study actually showed that when dogs have increased lactobacillus strains in their body, so we have a dysbiosis, so too much lactobacillus. So we want lactobacillus, but we don't want an overgrowth of it. What happens when there's too much lactobacillus in dogs, we can actually see signs of aggression for dogs. And yes, there are probiotics specifically for pets, and we usually want to use those if we can. Now, we can get human ones and use different dosages for pets, but there are so many good ones out there for pets. That's a great question. It's not a silly question at all, but you do want to get probiotics specifically for pets. So we're going to talk about some of those. So if you have a pet with anxiety, studies have also showed that low numbers of lactobacillus and bifidobacterium. So that's where we can look for a higher concentration of lactobacillus and bifidobacterium if your pet's stressed out, separation anxiety, using that alongside behavioral modification training, and it can help them, which is really, really cool. So that's how powerful these little tiny microbes are in manipulating, because remember, we have that gut-brain axis. We support the right bacteria. They're going to produce the right amounts of serotonin, your tryptophan, your other neurotransmitters, your other chemicals that are affecting the way that your pets feel. The same with us. Now, I don't know if those are the same strains for people. Definitely take a look at that. You can search on PubMed for articles about how we can manipulate gut microbiome with probiotics and food, which is really neat. So there is Bifidobacterium longum. So this is a specific strain. Perrine has taken that and they've created a calming probiotic. So I believe you can get that online now. And that's actually for anxious pets. So you can take a look at that and use that if you're having anxious pet problems. So your Saccharomyces boulardii, your second group of probiotics. So this is your beneficial yeast. Not all yeast is bad. We get worried. We're like, oh my gosh, my pet has allergies. I shouldn't give them yeast. There are good beneficial yeast. The good thing, the benefit of using the Saccharomyces is that they're resistant to antibiotics. So if you have a pet that's on antibiotics and we're giving a probiotic with like lactobacillus, bifidobacterium, that antibiotic is just going to kill it. Like it's not going to make a difference. And there's actually studies that show that giving that type of probiotic, especially after antibiotics, will delay the microbiome healing. So we want to be using the Saccharomyces when our pets are on antibiotics. So that way it's not being killed. It's getting to the colon. It's repopulating the gut health so that hopefully we can keep up with what the antibiotics are taking out. And then we have our soil-based. So these tend to be the bacillus strain. And these are the spore-forming probiotics that pass through the stomach. They get through the stomach acid. They get through the small intestine. They make it to the colon, and they help the body produce vitamins and antioxidants. They actually produce high carotenes. So the things that are in like carrots and brightly colored vegetables. So they're really, really neat in being able to help reduce inflammation and support those short chain fatty acid production. They're also hypoallergenic. If you have a pet that has food sensitivities, if you have a pet that has allergies, the spore-forming probiotics are really beneficial. And they're helpful also for pets needing digestive enzymes because they're producing enzymes. So if you have a pet with pancreatic enzyme insufficiency and they can't produce digestive enzymes, you can use this probiotic to support their microbiome and help them. They digest their food better. You're supporting their lining of their GI tract, so they're less likely to get the diarrhea. They're able to produce the B12 that's lacking. So there's a lot of good things that we can look at. So how do you dose probiotics? So it's going to vary. So first off, Lactobacillus bifidobacterium, super sensitive, most sensitive out of those 3 different probiotic types. You want high numbers of colony forming units. So this is where you can turn your bottle around, your package around, and you should see how many colony forming units of that strain of bacteria are present in that product. If you can't figure that out, we're out of luck. Like you're probably throwing money away, to be honest. So for these type of bacteria, we want at least 10 billion CFUs. If it's not at least 10 billion, and we can get there too if we like double dose. So say like ProViable is a common one, and it's 5 billion CFUs. You can double dose. So rather than it says give 1 capsule a day, I would give 1 twice a day, so that we're increasing the amount of CFUs in that pet's microbiome to hopefully give them a therapeutic dosage before all of them are wiped out or leave the body, because they don't last long. Your Saccharomyces, they're hardier, they last longer, so we need less of them. So typically we can look at 0.5 to 5 billion CFUs. And then we have our soil-based. So these are the bacillus strains. These are the hardiest. They get to the colon. They're the spore-forming ones that they're hardy. And we need less of them. They last longer. So 1 billion CFU. So that's something to follow for when you're dosing. Yes, look at the back of the package and see what it says, but now you can take a look and go, how many CFUs we have? We don't have 10 billion CFUs for these Bifidobacterium or the Lactobacillus, and you can go, I don't know if I want to use this one. Maybe I should find a better one. So what if you give, here's a common scenario. What if you give probiotics and your pet gets worse? This happens, it happens to patients, and mine will start them on a probiotic. They get worse, and a lot of times the pet parent goes, you made them worse, or that made them worse. I'm never using probiotics ever again. Like, have you ever felt that way? You're like, no, screw this. I don't want my pet to have diarrhea or feel worse. I don't want to pick up diarrhea or clean up diarrhea in my house. What's happening there? So now that we know there's 3 different categories of probiotics, they're all working in different areas of the gut. What's probably happening, and is actually more common than we diagnose and realize, is that your pet may actually have small intestinal bacterial overgrowth, Sibo. So many pets have leaky gut, because we're going to talk about diet in a second. Don't worry, we're going to get there. And with Sibo, so symptoms may be intermittent diarrhea, weight loss, gas, that irritable bowel syndrome. So they get diarrhea when they're stressed. Food intolerances. So you feed something different and your pet gets like blowout diarrhea, and you're like, I'm never feeding that again. Food intolerance, skin issues. Do you have a pet with allergies? Your pet may actually have Sibo. So I think someone asked a question about allergies before. And so you have allergies, you're giving steroids, or you're giving Apoquel, you're giving drugs, which are creating more imbalances in the gut microbiome and are affecting probably Sibo. So we're actually like making Sibo worse, which is crazy. But here's the kicker. Sibo is usually caused by diets that are high in starch, sugars, carbohydrates. What type of diet fits that? Kibble. Kibble's the highest in carbs and sugars. There was a Rodney Habib and Dr. Karen Becker did a video on the sugar content in kibble food, and they did prescription foods, and then they took like Purina puppy chow, like really low quality foods, and they compared the sugar content, and the sugar was higher in prescription foods, and it was like half the bag was sugar. It's insane how much sugar is in kibble, and it's feeding the bad bacteria. So your Bacteroides species, So that's one of the most common, good bacteria phyla that are in. So we had those different families of bacteria that we talked about at the beginning. Bacteroides are one of the most beneficial in your pet's gut. They love protein. And your Fucibacteria, they're usually half and half, but the Fucibacteria, for feeding, they love starches and sugars. So when we're feeding a kibble diet, it's manipulating the different levels and it's causing leaky gut. So that's where our diets are huge. Also, if we're using things that slow down gut motility, if we're using drugs that affect the microbiome, I talked about antibiotics, steroids are some of the most common ones, non-steroidals for pain control. Those are affecting the microbiome and could be leading to this Sibo-like problem. And so when we add lactobacillus and bifidobacterium, those probiotics are going into the small intestine where there's already this like overgrowth of bad bacteria. So we're essentially adding fuel to the fire. That's where you see probiotics worsen your pet symptoms. So if you're seeing that happen, we need to assess, okay, why is this happening? We need to use soil-based probiotics. We need to get them past the small intestine to the colon so that they're supporting those short chain fatty acids. We don't want them populating the small intestine. So that's huge. We need to be looking at that. After antibiotics, using those Saccharomyces predominant blends, and also your bacillus, your soil-based blends, looking for predominantly those when you're looking at a product. So that's really important. And let's finish with diet. So diet is key. Diet is the foundation to health. And this is why. Because it directly affects the microbiome. Your pet is what it eats. If it's eating kibble, we're feeding the bad bacteria, we will see disease. It will manifest. I guarantee it. And I hear a lot of times on Facebook groups and other communities, kibble's the best. No, it's not. It'd be like you eating a processed diet for the rest of your life. Who here, and I hope I don't see any thumbs up, so I'm telling you not to put your thumb up, but who believes that if you ate a Big Mac every day, you would thrive? Like, that's just absolutely ridiculous. Like, if you're eating bags of chips and chocolates and candies and all the processed foods that aren't real food every single day, all day, and that's the majority of your food, you are not going to have good health. You're not going to feel good. That's just a fact. And the thing is, with kibble diet, so unfortunately, and I've been there, I have the conventional medicine background. I worked in conventional clinics, and now I focus on holistic, and we can integrate the two together, and there is a place. However, when we focus on feeding kibble diets to resolve problems, we're missing the point. We're using something that's easier. It's easier to give that than it is to look at how do we transition these pets. And yes, getting your cat off kibble is difficult. So they demand it. And yes, Erin, my rescue kitten spent 3 days in hospital, stopped eating. They fed her prescribed Hill's kibble and told me to feed her the same, but I don't know, of course, and she's back to normal. So we can use these short term, get our pets through it, and then transition back onto better foods. When I look at the ingredients on the back of a prescription food diet, I get really sick to my stomach because, especially for cats, when we're feeding kibble, it's predominantly carbs. And as we just studies show, we are feeding the bad bacteria. And that's why your pets look normal, but there's this low-grade inflammation, this dysbiosis that's continuing, and then it manifests as a disease that we can give a name to. We don't want that. So how could meat derivatives and additives help any animal heal from the inside? That is exactly right. And the thing is that we are the only medical profession that recommends processed food for the life of your pet. It's just a fact. I'm not being condescending. It's what we're taught, and it needs to change. It's why 60% of pets now get cancer. It's why we're seeing an increase in chronic disease, GI issues, anxiety, behavior problems, allergies are through the roof. And so we need to be looking at diet and how are we affecting the pet's microbiome and their gut health. Fruits and veggies are good for us. Real food is good for us. It will be good for your pets. Now, a balanced diet, that's where it's missed a lot. And that's what scares vets, because there's a lot of unbalanced home cooked diets that are happening and it's creating long-term issues. So processed food does cause illness. Yes, it does. And you may not see any problems. Your pet just might be gassy their entire life and you're lucky. Like you got lucky. But I see enough patients, enough cancer. I see so many cancers every single day of my life, including my own pets. And I'm sick and tired of just sitting back and saying processed food is better and hearing that kibble is better for our pets, because it's not. And so what can you do with your diet? We talked about the Bacteroides. We need to feed them. They want protein. That's why getting your pets off kibble if we can, or at least adding real meat to their food 3 times a week, adding your leafy greens, adding those phytonutrients, adding the things that feed the good bacteria. We want to avoid foods that are really high in starches, high in carbs, too high in fats that create that imbalance and feed the wrong bacteria. A 2017 study was done and they fed a natural diet to dogs. And then they fed a commercially processed diet to another group of dogs. And they did this for, I think it was a year. And they looked at their microbiome. What do you think the results were? The microbiome in the raw fed diets, the more real food diets, was more diverse. So it had different strains and it was healthier. It had more diversity and abundance of good microbial populations compared to commercial. So why are we still recommending processed? It's too scary to recommend raw. We don't want people to get sick. Your pets aren't going to get sick. You have to transition them, but that's the thing. We can get sick from E. coli and salmonella. So we have to remember that. So exactly, my sweet essentials. That is exactly right. Why would I feed the dog something that is toxic for my kids to touch? Would you feed your kid, or would you feed yourself your pet's food? There's no way I'd eat that. Like I would have eaten Finn's food. I wouldn't have eaten his like raw chicken. I would have cooked it and then ate it. However, we could eat Finn's food. Like when I made Finn's diet, so our German Shepherd we used to have, when I did home cooked diets for him, I literally could eat his food for my dinner. I like that. I like knowing that he's getting real food. So the other thing we need to look at, probiotics are no good by themselves. They don't last long enough. So we need to feed them. What foods do probiotics need? They need prebiotics. So these are needed to feed the good bacteria, supply them with the energy and the nutrients that they need. And we want a variety of prebiotics. So when we do a variety of these, so let's talk about real food options. What are your real food prebiotics? We have your apples. You can add a little bit of apple. Bananas. You can add little bits. Remember, this is going to be higher in starches and sugars. So your green bananas will be a little bit better, but small amounts added into their food. Asparagus. Cook up some asparagus for yourself and for your pet, and it's really helpful for them, really beneficial for them. You're feeding the good bacteria. Dandelion, mushrooms, the beta glucans in mushrooms feed the good bacteria. It's a great source of prebiotics. And chlorella. So these are really good foods that we can add in. Good foods that are probiotics, kimchi, sauerkraut. You want to be careful sometimes with adding in dairy-based products. So I stay away from cow's dairy. It's inflammatory for us. It's inflammatory for our dogs. They can't break down the lactase. Or they can't, the lactose, they don't possess the lactase. And so they are sensitive to those. But you can use raw goat's milk, sheep's milk. It's a different type of casein that they can tolerate. And so we can use those also for digestive enzymes and adding in the good probiotics. So look at real food differently. Look at food differently. We have to. If we want our pets to live a long, vibrant, healthy life, we have to look at the way the food is affecting their microbiome and is affecting their overall health. It's key. And that's the thing that's being missed in medicine, hands down. So this is a great point with feeding raw foods. So it goes back to what I just stated. Concerns about harmful bacteria in the house. Raw is not for everyone, and it is not for every pet. If you are immunocompromised, you have young kids in your house that go in the bowl, do the things like kiss on the dogs after they ate their food. You have elderly people in your house. You don't want to be using raw because it does have higher bacteria levels. So, and also you need to be making sure that you clean up properly. It's like us cooking with raw foods. Like we don't lick our hands. You wash your hands, you wash the materials. You don't use the same knife to chop up the raw vegetables for the salad after chopping up raw meat. So those are things to keep in mind. And a lot of pets that are coming from kibble to raw diets, their microbiome's off for those very reasons we just talked about. And what happens is a lot of people are like, I have to get them off kibble, because you'll listen to this and be like, I have to get my pet off kibble. And then they go straight to raw and it causes vomiting, diarrhea. And then you end up in the ER and I don't want that. So you have to do a transition to it. If you are thinking about transitioning to a raw diet and you are currently feeding kibble to your dogs and your cats, we need to get these good probiotics in, start adding in these prebiotics into their food, looking at, okay, maybe we run some tests and see, is there like Sibo affecting our pet? There's different blood tests you can ask from your vet, GI panels that they can run to see, okay, why is my pet always having GI upset? Animal biome, you can test a stool sample and look for good bacterial levels. So some of the different brands, I'm just going to go through a couple because I've gone way over. 4-Leaf Rover product. So 4-Leaf Rover has a lot of different ones based on what we're looking to achieve. And they're a good brand. So you can take a look at those. Those are good. There's a lot of soil-based prebiotics. There's the Saccharomyces. ProViable is another great option. Fortiflora. So this is a really common one that's prescribed at vet clinics. So it's only one strain and there are no prebiotics. When you're looking at a probiotic supplement, you want to see prebiotics. Those prebiotics, as we just talked about, feed the probiotics. There is no good thing giving a probiotic if you're not feeding them. So if you don't see has prebiotics on the label, or you look for inulin, fructooligosaccharides, cellulose, some of those things that are going to feed it, then I wouldn't buy it. So keep that in mind when you're looking at those labels. And also looking for multiple strains. That's why I'm not a big fan of Fortiflora. It also has animal digest. I feel like it affects patients that have food sensitivity. So there's other better options that I would recommend. Mercola Complete Probiotics, like them, use them for a lot of my patients. And Answers Pet Food. There's also Thorn Bacillus Coagulans Vet. They're a great brand also. If you want more, you want the names of the things, you want all the things, you want to go more in depth, we went into all of these topics, the things that affect your pet's microbiome in our webinar this past week on how to support your pet's microbiome to prevent disease. The replay is on right now. It's already there. You can access it. You can watch it as many times and take as many notes as you'd like. And you can get that at thenaturalpetdoctor.com. So just go there, sign up. I guarantee it's $10. It's nothing. And you can watch it as many times as you want. I'm going to actually keep it going for a few more days because there's so many people that are gaining benefit from that. And it is such an important topic. So go to thenaturalpetdoctor.com. It'll be a pop-up and you can access that. I will put the link below this so that you can take advantage of it and watch it and rewatch it and just take notes, because this is the key to health. Your pet's microbiome. You fix that, you fix your pet. It's not easy. I'm not saying it's easy, but we can fix your pet's health. I do it every day with my patients. If you want more individualized care, do the webinar. If you need help with the nutritional plan, there's a special for our nutritional plans in there that you can access to. So make sure you check it out. These are why we do this. Next month's webinar, or this month, it's already October. So this month's webinar, we are going deep into vaccines. So stay tuned for that registration link, because we are going to talk about vaccines. We're going to talk about titers. We're going to talk about what's necessary for your dogs, your cats, why it's affecting their microbiome. So if you want to be one of the first to see that link, make sure you subscribe to our weekly newsletter. Tips, hints, resources, stuff. Go to the Natural Pet Doctor, sign up for our newsletter. You sign up for our webinar, you'll go into the newsletter. You get a lot of resources. I love giving and giving and giving. That's why I'm like 30 minutes over our 30-minute coffee talk. I just get so excited about helping and empowering people, pet parents, amazing pet parents like you, so that you can do what's right for your pet. And you know what questions to ask when you go in the vet clinic. This is so key. My sweet essentials, that's exactly right. I need to find out more on vaccines before our next appointment. I had someone make a comment on one of my social media posts. Make sure you like and follow these also. We post like 4 times a day on helpful tips and hints on social media. So Instagram, Facebook, go to our private Facebook community. It's free. We go live every Wednesday. It's free. Just join it. If you don't like it, you can leave. No harm done. However, I had someone post that their vet told them they had to give parvo every year. It's a 3-year vaccine. That is the American Veterinary Medical Association guidelines for all veterinarians. They were told there were no titers, which is a lie. They were told they had to give it every year, which is a lie. And you're over vaccinating. And then it killed my heart seeing that, because she wanted to do what was best for her pet, and they made her feel bad that she wasn't doing the right thing. So this is where this information is so powerful, and you can take this and you can say, no, these are the resources. This is the AVMA's vaccine guidelines for the best care for my pet. I want to do a vaccine titer, or no, I'm only going to do this every 3 years. Look, it's right here. And so that you have that knowledge, you have that information, you have that empowerment. And unfortunately, yes, we have to give the same dosage regardless of the dog's weight. But this is why vaccine titers are so important. And there's so many other things, and we're going to be talking about them. So stay tuned, but make sure you take advantage of that webinar while it's available for the microbiome for your pet's health, so that you can go through it and go through those resources, because they're invaluable. And like I said, it's the key to health. We fix your pet's microbiome. It's the key to lifelong health. And so, yes, there's so much with vaccines. The titers, rabies, we're going to talk about that. Rabies is a hard one because it is legally required. And so there are different ones that there's a lot it's hard, but that's why we're going to have that hard discussion and go through that in our webinar, because the more information that we can provide, and also we do a Q&A. So I'm sure it'll be a really long Q&A because it is a hot, sensitive topic, but we can go through those questions that you have and what's coming up from your vets across the world, and how we can better inform and educate and empower and do the things. So that's why I do this. That's why every Saturday, join us 10 a.m. Next week, we are talking about getting a puppy. A lot of people got new puppies over COVID, this whole pandemic. Some are thinking of getting puppies. What is that checklist? What are the things you need to look at? What are things you can ask breeders? I used to work for a conventional clinic where we did health testing for pets. I did artificial inseminations. I will never do that again. I'm not going to lie. It was not my cup of tea, but I learned so much, and I learned about the resources for pet parents like you. If you're thinking about getting a puppy, what are the health testing they should be doing for that breed? Where can you go and look? What can you ask for? What are these hip scoring? What are the things, what are those resources? And then before you get the puppy, how can you set yourself up for success? What are the things that you need to be looking at? How do you transition the food off of the food they're feeding probably? What are about vaccines, that kind of stuff? How do you support their bodies? So we're going to be talking about that next week. So if you want to get reminders of when these are. You can also register for our coffee talks with the doc. If you're on Instagram, click the link in our bio. And you can also, I believe you can actually access it too on our website right now. Also, you can register for that. You'll just get a reminder an hour before when we're going live. There's a Zoom link too that you can join us on if you'd like to, or you can join us here live at Facebook and Instagram. So make sure you check out thenaturalpetdoctor.com. Stay tuned for that vaccination webinar link that we'll be posting probably within the next 2 days, but join our weekly newsletter at thenaturalpetdoctor.com and you will get all the things. So thank you for tuning in. Thank you for all your questions. I appreciate you and your engagement and showing up. A lot of you come every week and I love seeing you here. So have a fantastic weekend. I'm Dr. Katie Woodley, the Natural Pet Doctor. Take care.